Hi, my name is Christina Perkins, and I'm the Benefits Specialist for Fauquier County Public Schools. Welcome to the Open Enrollment presentation for the 2017-2018 plan year. Today's objectives are to give an overview of the medical and dental plans and the rates, to review services provided by our vendors, look at the voluntary benefit options, and to review the process of completing your open enrollment. Important dates to remember are that open enrollment began April 18th and will end April 28th. Premium changes will begin in June in your June 2nd payroll for biweekly and your June 30th payroll for monthly. July 1st is the day that all new enrollments and plan changes will become effective. So what is open enrollment? Open enrollment is the one time a year when employees can change medical, dental, and optional benefits. All employees must enroll in open enrollment in ePortal. Even those that plan to waive or decline coverage, you must log into ePortal and make those choices. If you plan to make no changes, you will indicate that in ePortal as well. All flexible spending participants must re-enroll every year with American Fidelity. All health savings account members must re-enroll every year with Benefit Wallet. This is the one time a year when insurance plans and rates are renewed. The information contained in this presentation is only a summary. Full enrollment details, guides, and instructions can be found on the Open Enrollment webpage. The information you need to know for this year are there are no benefit changes to the health or dental plans for the 2017-18 plan year. There are no changes to the rate structure for medical insurance, and there is a 7% increase in the rate structure for dental insurance for this plan year. Our health insurance options are brought to us by Anthem. We have 3 plans. KeyCare 15 is a PPO or preferred provider organization. When members receive services, they will pay a copay or coinsurance. A copay is a set dollar amount. A coinsurance is a percentage of the amount billed. HealthKeepers 20 is an open access HMO. Members will pay copays when services are provided. It does require that members name a primary care physician. However, a referral is not required when members need to see a specialist. The third option is called Luminos. It's a high deductible health plan, and after the deductible is met, members will pay a coinsurance. All Luminos participants do receive a health savings account with contributions made by Fauquier County Public Schools. All plan summaries and rates are available on the Human Resources webpage at fauquiercounty.gov. All health insurance participants do receive a prescription drug coverage. Those enrolled in Luminos plan will receive their drug coverage from Anthem. All other participants will receive their drug coverage through Optum Rx. Optum Rx will provide members with a separate drug card, and this is the card you should use at the pharmacy. Finding a primary care physician is as easy as going to Anthem.com and using the Find a Doctor tool, or select the primary care physician link on the Human Resources webpage. So what is a health savings account? A health savings account is used in conjunction with the Luminos High Deductible Health Plan that allows users to save money tax-free to pay for qualified health care expenses. So the contributions are tax deductible, the earnings and interest grow tax-free, and withdrawals for eligible medical expenses are also tax-free. That is why a health savings account is known for its triple tax savings. You can change your deductions at any time throughout the year. The funds do roll from year to year, so the bank account goes with you right into retirement. You must keep your documentation of medical expenses so you can reimburse yourself as you go using your health savings account debit card, or later by submitting them in a lump sum. Additional services provided by Anthem include Live Health Online. Live Health Online provides employees the opportunity to meet with a doctor over the internet using a computer or mobile device with a webcam. This service is for a $0 copay for health insurance participants, but all employees can use it for the fee of $49. When it is medically necessary, the physician in the Live Health Online appointment can provide a prescription if needed. They also provide a 24-hour a day, 7 days a week nurse line for non-emergency medical questions, or if you need to ask where's the best place to receive treatment. They also provide Future Moms, which helps expectant mothers have a healthy and safe delivery. There is also something called Condition Care, which is a healthcare management program for chronic illnesses such as asthma, heart disease, diabetes, high blood pressure. You would be assigned a nurse case manager that would keep you updated on the newest research, medicines, and treatments to help manage your condition. Live Health Online also brings us Live Health Online Psychology, where you could meet with the psychologist from the convenience of your home or office. Anthem also provides us with our employee assistance program. This program is completely confidential, and it's free to all employees and their household members. So you can reach them through their website at anthemeap.com or their 800 number. And this helps employees with everyday problems, big and small, such as maybe they need to meet with a psychologist for family counseling or grief counseling, maybe just need help finding legal assistance, or just finding a daycare for your family. We are providing you with our health insurance rates for this plan year. These rates do not reflect any increase, as our rates have stayed the same. They are available on the open enrollment webpage. Our dental insurance are brought to you by Anthem. So we have a high option dental, which provides coverage towards orthodontics, major restorative, and basic and preventive services. Then we also offer the standard option, which provides coverage towards basic and preventive services. Your basic and preventive services are your cleanings, your x-rays, and simple fillings. Your major restorative services are including crowns and root canals. Dental insurance rates do reflect a 7% increase this year. Before you make your elections this year, please be sure to review the Anthem plan information provided to you in the benefits guide or online at the open enrollment webpage. It can be found at faulknercounty.gov. All benefit guides are being distributed to all school locations. Flexible spending accounts are administered by American Fidelity. A flexible spending account allows you to set aside money on a pre-tax basis for medical and dependent care expenses. You can enroll on the American Fidelity web page or with an American Fidelity representative at your school location. The calendar of their schedule is available on the open enrollment web page. While your retirement benefits are not bound by the open enrollment dates, it's a good time for you to review your retirement options. Perhaps you need to update your VRS or ICMA beneficiary forms. So ask yourself, are you prepared for retirement? Because now's a good time to look at your deferred contribution amounts, whether to VALIC or ICMA. It's also a good time for you to review your optional life insurance to see if you are providing the right amount for your family. Our voluntary benefits are brought to you by American Fidelity and AFLAC. They provide policies for cancer, critical care, disability, and accident insurance. This is to supplement your other health and dental insurance. If you are interested in one of these policies, please contact a representative, and their contact information is available in your benefits guide and on the open enrollment webpage.
You wouldn't blow out birthday candles with a fire extinguisher, so why would you go to the emergency room for a small rash? You wouldn't wait all day for a parking spot, especially when there are plenty of open ones nearby. So why would you wait for 4 hours at the ER to find out you have an ear infection? You wouldn't pay $100 for a cup of lemonade. So why would you pay $1,200 at the ER just to learn you sprained your wrist again? When you need care right away, but you know it's not really an emergency, you've got options. And they could save you some serious time, money, and your sanity. Your primary care doctor should always be your first choice. But let's face it, you don't just get sick during business hours. And injuries don't always happen near your doctor. Before you rush to the ER, think about this. A visit to a retail health clinic, which you'll find in many major pharmacies and stores, costs about $85. With Live Health Online, you can have a video visit with a doctor for $49 or less, depending on your plan. And you don't even have to leave home. Urgent care centers are another great option. And most are equipped to handle x-rays, lab tests, and stitches, things that may have brought you to the ER before. Of course, sometimes it's a real emergency. You know, the can hardly breathe, won't stop bleeding, might need a body cast kind. Then it's always best to go to the ER or call 911 immediately. If you're not sure where to go, call your doctor or use our 24/7 nurse line to talk to a nurse anytime, day or night. You'll find that number on the back of your ID card. You wouldn't bathe your dog at a car wash, so why would you rush to the ER with a migraine? There's a time and a place for going overboard, but not when it comes to the ER. So don't wait until you need care. Find the closest options for quick care in your plan now. Just go to our website or download the mobile app to get started.
This video was to help us be smart consumers so that we can continue to keep these rich benefit plans with low premiums. Sometimes we all miss deadlines, but this is not a deadline you want to miss, because what happens if you miss the open enrollment deadline? Your current coverage will end and you cannot re-enroll until next year unless you have a qualifying life event. Qualifying life events are marriage, divorce, birth or adoption of a baby, or the gaining or loss of other coverage. So to make your open enrollment elections, you're going to go to ePortal at fauquiercounty.gov, click Employee Self-Service, then Benefits, and then click Open Enrollment. At the end of open enrollment, you're going to receive an email for you to review your open enrollment options. Be sure to review this carefully so that it's processed correctly. Otherwise, it will be processed as you have indicated in your elections. So during open enrollment, we are here for you. We have open labs at Central Complex on April 24th, 25th, and 26th. We also have extended HR lobby hours for your assistance from 3 to 6 on April 26th and on April 27th. Thank you for participating in this presentation. I also wanted to remind you that the Human Resources Open Enrollment webpage can be found at fauquiercounty.gov, where you can find all open enrollment information, including electronic benefit guides, plan summaries, and rates. Thank you.